Hello, everyone. I'm Allie D'Amico, Director of Clinical Operations at MoCo, one of our nurse practitioners here. And we are here with Dr. Scott McMahon, our Medical Director, and one of our leading experts in the mold toxicity community. And we're here with Dr. Scott Answers. This is a segment where we take 3 questions from Reddit and we get some advice and some information from one of our leading experts. So, Dr. Scott, how are you?
I'm doing great today, Allie. How are you?
Can't complain. Can't complain. We can dive right in here. Let's see our first question that we got from Reddit. Someone asking about sleeping outside. So this person says, has anyone slept outside but still used the house during the day that had mold issues and seen any improvement in their symptoms? I live with my elderly mom and am slowly trying to convince her about mold issues from a roof leak and the need for remediation. Most of my symptoms involve waking up and feeling awful. I'm hoping sleeping outside will help my health. Anyone has had success, please let me know. So, Dr. Scott, what would we say to this person? Do you see this often?
Unfortunately, we see it way too often. So patients sometimes sleep in a tent in their backyard, or they create some other kind of enclosure. They live in an RV behind or in their backyard. Some people have gone to such extremes as to move to the north rim of the Grand Canyon, and they actually live in tents there for 9 months out of the year in an attempt to have extreme exposure avoidance. In fact, that's what some people call it, is extreme exposure avoidance. Some people are just that sick. Fortunately, most people are not sick to that degree, and they can do other things. They can use like a number of different air purifiers in their home. Some of them are good for up to 3,000 square feet, but might need more than that. If you are using air purifiers, you probably want to move them around the room that you're purifying a couple times a day, even if you have that kind of ability. It might even be better to put them in one corner and then move them around or switch them to different rooms. Some people will build a tent inside their home. They'll use painter's plastic and they'll go from the ceiling down to the floor, and they'll make a rectangle. They'll put their bed in there, a desk, eat their meals there, do their work for the day. And that's fully enclosed. And they put somewhere between 1 and 4 air purifiers in that. Call that a safe room. The idea is in your home, you have one room that's safe. I mean, ultimately, the best thing is to remediate, and to remediate properly. You usually have to get an indoor environmental professional to find where all the problems are, and then get together with a remediator that are actually aware of SIRS and understand that if you have mold toxicity or SIRS, that you need special care, that you need above and beyond cleaning, small particle remediation, and things like that. If it's not done right the first time, you end up having to do it a second time, and that can cost you another $20,000, $30,000. So it's better to take the time and do it right the first time. But if you can't remediate, or if you have to wait a few months to get out of your place, then some of these other options work. I also know of people that live in their car. They've purchased like a Jeep and taken out, or a van and taken out all of the upholstery. They typically tape the air conditioner vents shut because cars are not really made well to avoid mold from coming in there. And they just fashion that as the place that they live. It's really tragic to see the extent that some people go. And fortunately, most of us don't have to do that.
Yeah, I like the idea of that safe room. That seems like a relatively easier option for people, just putting up the plastic and they can still have their own bed and their own furniture. Of course, they probably have to clean their furniture before moving them into the safe room, with the HEPA vacuums and cleaning all their porous material.
For sure. For sure.
Right.
Yeah, it's a terrible thing. Obviously, the best thing is to remediate or to move, but some people are stuck because of resources or energy level, or difficulty finding another place to move where that is not a quick option. And so all of these things are ways to minimize your exposure while you're ultimately either moving or getting remediation done.
And if people do that, say someone does sleep out in a tent for a couple nights or get in a safe room, do people notice a resolution in their symptoms? Or not a resolution, but at least an improvement?
Yeah, they definitely do. They notice an improvement, and then when they go back, let's say they sleep outside, when they go back in the morning to shower or to change clothes or make food or whatever, they often notice a difference when they go back in.
Interesting. All right. Thank you. All
You're
right. Let's
welcome.
move to the next question. This is a great question. Someone's
They're
in
all great
mold.
questions, Allie.
They are great questions. So we're in mold. We need to move. How the heck do you go about finding an apartment? And how can you ensure that you're escaping one apartment and you're not going into another moldy environment?
Yeah, that really is a great question, and to be honest, for most people, this is very difficult. It's one of the most difficult things around, requires perseverance. The fact of the matter is landlords lie. They'll tell you that there's never been any water events or anything like that when that's not true. They'll paint over mold. Now, not all landlords, but many will just paint over mold when they find it, visible mold on your ceiling or in a closet or something like that. So if you're going to use a real estate agent, the first thing to do is tell them you can't go into any place that has a history of mold. And hopefully they'll do that screening and hopefully landlords will be honest about it. Uh, you can get a hurts me too. You can get a dust test from Molco, for instance, and you can check it. Usually you can get those results within a week, week and a half. Some markets don't really allow you to do that. Like in San Francisco, if you see an apartment today, you have to say yes today, or someone else will take it tomorrow because the markets are just that tight. So the absolute best test that I know of is your own personal body. Of course, that's putting you at risk, but you go in and you spend as much time as they'll let you. If you can spend an hour, spend an hour. If you can spend 3 hours, spend 3 hours. If they'll let you stay overnight, bring a sleeping bag and sleep overnight. And the reason we do that is because your body is more sensitive than any mold test that's out there. And it's not just mold that can trigger you. It can also be spirocyclic drymanes or volatile organic compounds, or I actually have a list of 30 different things that can trigger your innate immune system and cause the problems of mold toxicity. So your body really is the most sensitive detector and it senses all of the potential things that can trigger you. So the more time you can spend in there, the better. And if in the morning you feel pretty good, like, wow, it's like I just got a vacation from my current place, that's a pretty good sign that you're going to tolerate that. If, on the other hand, you feel crummy in the morning or just as bad as you do in your current location, that's probably a good sign too. Just a good sign to keep searching and not to take that particular place. It's also important to mention that if you do find a good place, that it's really important to clean the articles that you're going to bring with you. We sort these things into porous, non-porous, and semi-porous. Non-porous things like glass and metal can be cleaned. There are a number of different solutions you can do to get all the dust off. You're not trying to kill anything. Same with semi-porous, like wood products. If the mold is growing into it, you need to discard it. If it's surface level, you can clean it off or sand it with a HEPA filter vacuum next to it to capture all the dust. Porous things are really, really difficult. We have other resources that talk about that. But if you take porous things with you, there's a good chance you're going to cross contaminate and bring the mold from your current apartment to your new apartment, and then moving really isn't that beneficial because you just brought the same problem with you.
Mhm.
To me, the best approach is to spend as much time in it as you can, and if you have the freedom to test it, to do one of the dust tests, either an ERMI or Hurts Me Too. Again, you can get the Hurts Me Too through moco.com.
And also, I would mention, looking around. Look for stains on the ceiling, look for stains on the wall, look for any abnormal, people do look under cabinets and they can actually see little fuzzy growths under there, you're definitely looking at that to make sure that that's not the case. And just
Absolutely.
quickly, I know I see a lot of people that might even bring off of Amazon or something, get little petri dish testing or the air trap testing. Can you just explain the difference between a little petri dish, something that you can get offline easily, and a dust test?
Sure. So the petri dishes that you can get online are worthless, or you can get them at Home Depot. You can go pick one up, and you're instructed to put it out for 5 minutes and let the air kind of settle dust on it, and that's really pretty worthless. There are 1 hour what are called gravity plates. It's the same thing. It's a petri dish. You leave it out for an hour. It's more accurate, but it's still relatively worthless because it's a very large error in sampling. If I was going to do a plate like that, I would leave it out for 24 hours. But that's still one of the least useful methods um, of testing. You could bring to an apartment an indoor environmental professional who has a spore trap test that also does about 5 minutes worth, and it sucks between 75 and 150 liters of air. So about 4 liters to a gallon. It just sucks that air through there and it traps spores. And that can be useful, but if it's negative, it also is a worthless test. It doesn't mean anything. If it's positive, it says, yeah, don't rent that place. The dust test is really the most sensitive measure. And for somebody who's sick, you want something that's very sensitive. And both those other tests are not very sensitive. They miss large amounts of the answers. So those are the really best tests. And you mentioned using your eyes, looking for visible mold and musty smells. And let me try that again. You mentioned, using your eyes and looking for visible mold and whatnot. But I would also add that you should use your nose. Sniff around whenever you're around a sink, for instance, and you're looking at that cabinet underneath. Take a sniff. When you're in closets, look up to make sure that there have been no leaks from the attic that nobody is even aware of, for instance, and sniff. Do you smell earthy, musty, mildewy kind of smells? Because if you smell it, it's there. If you see it, it's there. And so that's a place that you should avoid. But be aware uh, that using your eyes, using your nose will only find mold in about 50% of the places that have it. The other 50%, it'll be hidden in places you can't see it or smell it. And that's where the dust test comes in.
All right. Super helpful. Thank you. Uh, all right, let's move on to our last question, and this is more symptom related. We have someone that is saying that they're having muscle loss and some muscle wasting due to mold or mold toxicity. This person says, I was in a moldy house for 7 months, heavily exposed. I have muscle twitching and muscle loss. I can notice it in my hands, forearms, shoulders, maybe hips. I've gained fat too. Have a chronic sinus infection, white rubbery mucus, milkish saliva. I'm out of exposure now, but I'd like to know if anyone has had similar symptoms and what did you do to get better and how are you right now? So do you see this severe muscle loss or muscle wasting?
Yeah. Well, the first question that I like to answer is what should I do to get better? And that is go to moldco.com. But yeah, we see all of those symptoms as a part of as a part of mold toxicity. There are different reasons for it. So the congestion, for instance, the molds can be directly irritating to nasal passages and can trigger congestion in everybody, whether you have a genetic predisposition or not. It tends to be worse in people that have the genetic predisposition. You make more mucus, you feel congested. You can feel congested 24 hours a day. You can feel congested all year long, as opposed to like seasonal allergies where it's maybe just during spring or just during fall. As far as twitching, that's a neurologic symptom. And we know that a number of mycotoxins can be directly neuropathic or damaging to nerves. And so it can lead to twitching, numbness, tingling, a number of different symptoms. We also know that you can have muscle wasting, and there's a couple reasons for that. One of the things we see most commonly in people that have mold toxicity is that they're not making as much energy in their cells as they used to. And because the cells are not making as much energy, they have to ration the energy they have to perform all the different functions that the cell is supposed to perform. So instead of having excess, you actually have a deficit. And when that happens in the muscles, then the muscles don't work as much and you can get wasting from that. Another thing is because of that depletion in energy, people are tired and they're just chronically fatigued. So they're less likely to go out and do their exercise. Although some people will push anyway. And because they push, they oftentimes, again, because their body's not making as much energy, they push themselves into what's called anaerobic metabolism. That's where the oxygen supply that you breathe in can't keep up with the amount of exercise that you're doing. And that pushes the body into a whole nother kind of energy production, which creates deficits, creates lactic acidosis, or puts you in a situation where you basically have to recover. And it may take 2 or 3 days to recover instead of the normal within 24 hours that you recover. We call that the push crash, where you've just pushed yourself so far that you crash for the next 2 or 3 days while your body recovers. You may not even be able to get out of bed or go to work. Well, as a result of that, your overall exercise tolerance is decreased. You get post-exertional malaise, which is related to chronic fatigue, but other chronic fatiguing illnesses. When I say chronic fatigue, I mean chronic fatigue syndrome. And other related chronic fatiguing illnesses, they all have this post-exertional malaise, or after you've exercised, you're really wiped out. Not like the normal, like I did a heavy workout, but tomorrow I'm going to be fine. It's I did a heavy workout and I'm not going to get out of bed for the next 2-3 days. We really encourage people not to do that. And so that means we don't want you to exercise as much until you start getting that aerobic capacity back, which comes from your cells being able to make energy. That's what gives you that aerobic capacity. Until that comes back, pushing yourself with exercise to that degree is actually detrimental. And your doctors will say, oh, you just need to diet and do more exercise. But the truth is, patients that have mold toxicity really physiologically can't do that exercise, or when they do, it's harmful. So we ask you to kind of cut back on that and gradually increase until you can do that. And of course, because you're not exercising as much, you'll get some muscle wasting from that too.
And then the best way to regain the stores of energy in those cells is by getting out of environment and then treating be the best way. Is that what you would suggest?
Absolutely.
Okay. And so
Absolutely.
it
That's one of the fundamental
go ahead.
That's one of the fundamentals of medicine is to treat the underlying problem. The underlying problem here is mold toxicity. And so you treat that by getting out of your exposures and taking an appropriate binder for a relatively short amount of time. And that'll put you back on the pathway to where all of those things can recover.
And just as a follow-up, so if I'm not sure if I'm exposed to mold and I'm just looking into this, but I feel my muscles are weak and they're twitching and I have this sinus congestion and I go to moldco.com and I order labs and I order a complete blood panel to try to see what's going on with my immune system and my neurological disorder. Is there a specific lab I might be looking for that's abnormal that might be linked to this muscle problem that I'm having?
Yeah, there are a number of abnormal lab tests that can be linked to mold toxicity, which then leads to this whole progression of other things happening. So, for instance, you can look at your MSH level, alpha melanocyte stimulating hormone. MSH is almost always low in people that have this, and that means they can't regulate their immune system properly. There are several cytokines that we almost always see are elevated. So, 80% of the time or higher. TGF beta 1 is one, MMP9 is another, C4A is another. We'll often see abnormalities in the endocrine system too, in your hormonal system. So we look at ACTH and cortisol in combination. Cortisol has to do with how much energy that you have in your body and how go you are. And we often see abnormalities in that somewhere around 60% of the time. ADH and osmolality is another endocrine another couple of chemicals, and they determine how well you or how frequently you urinate. But more globally, they look at your fluid balance in your body, and it's off usually 85, 86% of the time, patients that have whole toxicity. So all of these markers are valuable. You can find pretty much all of them on the complete panel at Moldco at much, much less than what they cost if you were to go to the lab, and your PCP were to send you.
Excellent. That was really helpful. Hopefully everyone learned a lot in this episode of Dr. Scott Answers, and we look forward to seeing everyone next time.
Awesome. Thanks, Allie. This was great.
Yeah.